Emphysema. Emphysema is a long-term progressive disease of the lungs and occurs when the alveolar walls are destroyed along with the capillary blood vessels that run within them. This lessens the total area within the lung, where blood and air can come together, limiting the potential for oxygen and carbon dioxide transfer. Emphysema symptoms. Breathlessness, most common. Shortness of breath is by far the most common of emphysema symptoms. In people with emphysema, the muscles responsible for breathing have to work harder and tire out sooner. The result is feeling breathlessness at first with activity and at rest in advanced emphysema. Other emphysema symptoms: wheezing, cough, chest tightness or pain. This video describes the emphysema: introduction, damaged lung, part of the lung.
Emphysema is part of a group of diseases that make up COPD, or chronic obstructive pulmonary disorder. Now, COPD is a name given to diseases in which air exchange is impaired by the narrowing of the lower airways or by the destruction of the alveoli. Now, let's focus on emphysema. Emphysema is an incurable airway disease of the lungs. Emphysema is characterized by the destruction of the alveoli, its walls, and elasticity. It is part of a group, as I mentioned, of diseases that make up COPD. To understand this disease, we must first review the respiratory system to get a better understanding about what this disease is all about. The respiratory system consists of anatomical structures involved in ventilation and gas exchange. It allows us to breathe oxygen in and exhale carbon dioxide out. Let's look at this in a bit more detail. So the respiratory tract can be divided into two parts, the upper and the lower respiratory tract. The upper respiratory tract includes the mouth, nasal cavity, pharynx, and larynx. The lower respiratory tract includes the trachea, which branch out to the bronchi and then to the bronchioles, and finally to the alveoli, where gas exchange takes place. So what would be happening is that oxygen will travel through this pathway to the alveoli and carbon dioxide will be exhaled from the nose. Let's zoom into these normal lungs, and look at a normal alveoli. So the alveoli are found in bundles like so. Here we have the bronchioles, the terminal bronchioles, which will join to the alveoli. And alveoli is plural, so alveoli is composed of many alveolus. There is rich blood supply around the alveoli because this is where gas exchange takes place between oxygen and carbon dioxide. So we have deoxygenated blood entering the alveoli and reoxygenated blood leaving the alveoli. Another fundamental point to take in about the alveoli is that the terminal bronchiole and each alveolus is wrapped around by elastic fibers. But why would they be wrapped around by elastic fibers? Well, this is to allow the alveolus to expand when receiving oxygen and then to deflate when exhaling carbon dioxide out. Same for the bronchiole. So remember, oxygen and carbon dioxide are exchanged essentially within the alveoli.
Another cause apart smoke, air pollution, occupational exposures. For example, chemical, diagnostic, spirometry, chest X-ray, complete blood count, exercise breathing, analysis of arterial flow is used to determine the need for oxygen. What is the treatment for emphysema? Emphysema is not a curable disease. Once lung damage has occurred, it cannot be reversed. The goal of treatment is to stop further lung destructions and preserve lung functions. The patient needs to know that the focus is on improving quality of life and limiting the introduction of emphysema on daily activities. Emphysema tends not to be the primary cause of death, but can be a contribution factor to other organ failure. Physical examination. Physical examination will concentrate on the lung findings, but may also include the heart and the circulatory system. Is there an increased respiratory rate? Is the patient short of breath just sitting in the examination room? In addition to the ribs and the diaphragm, is the patient using the intercostal muscles and neck muscles to breathe? When used, accessory muscles cause the appearance of injury, where this is observed talking is a muscle during the breathing cycle. You can see a video.
Alveoli. So if we were to look at it even closer, gas exchange occurs between each alveolus and the capillary, the blood. So oxygen is exchanged for carbon dioxide in the alveolus. Also, if we cut a cross-section of the terminal bronchiole of this lung, of this normal lung, we can see that it does contain a wall. It has a wall. It has some mucus, perhaps, and an open airway, which is very important because this will allow gas to flow comfortably through. Okay, so now that we know a bit about the structure and function of the normal lungs, let's look at a lung with emphysema. So I'm going to draw the exact same diagram except of an alveoli and the terminal bronchiole, except from a patient with emphysema, for example. So one of the notable key characteristics of emphysema is the loss of elasticity, both in the terminal bronchiole and notably on the alveoli. Also, emphysema is an abnormal, it's a permanent enlargement of the air spaces with destruction of the alveoli and alveoli wall. And usually this is without obvious fibrosis. So the main reason for the destruction of alveoli and elastic fibers is because the immune cells begin secreting chemicals known as protease. And this is all part of the inflammatory response, so it's actually an inflammation. An increase in protease results in the destruction of elastic fibers and collagen, and this will cause enlargement of the air spaces and destruction of the alveoli and the walls. So essentially, protease will cause destruction of the alveoli and elastic fibers. But again, what's important to understand is that the alveoli itself does not enlarge. It is the space that enlarges. So this enlargement in airspace volume will cause some serious symptoms. Of course, we still have the blood supply and oxygen exchange that will be affected due to the damage of the alveoli. And anyway, cutting a cross-section of the bronchiole with emphysema, we see a thicker wall to compensate, an increase in mucus due to inflammation, all of which contribute to the narrowing of the airways. Now, the narrowing of the airways will cause difficulty in breathing, in
Smoking cessations. The number one treatment goal is to have the patient stop smoking. Education, counseling, support groups, and medication may be used. Moreover, prevention is most important, and not starting to smoke is much easier than helping a person to quit smoking. Medical treatment: corticosteroids, bronchodilators, other medications, long-term antibiotics. You can see a video, the type of emphysema, symptoms, and more.
There are actually four main types of emphysema. Before going into each one, let's briefly look at a normal alveoli and the terminal bronchiole. So here is the bronchiole and the alveoli, which is made up of many alveolus, remember. The first type of emphysema is known as Cenar emphysema. And this is where we have focal enlargement and destruction of the respiratory bronchioles, whereas the distal alveoli are unaffected. The second type of emphysema is paracenar emphysema. This involves the enlargement and destruction of all portions of the acinus, which is basically enlargement and destruction of the bronchioles and the alveoli, essentially. Then we have the third type of emphysema, which is the paraseptal emphysema. This is where the bronchioles are unaffected, but we have enlargement of air spaces and destruction of the alveoli. Then there is the paraseptal emphysema, I hope I pronounced that right, or irregular emphysema. This is often seen in individuals with inflammatory conditions and is mostly involved in scarring of the tissues, so it is associated with fibrosis. So emphysema is not a disease that you can just have the next day. Emphysema is a chronic disease occurring over a course of many years. Dyspnea is usually the first symptom and can occur even at rest. Dyspnea is discomfort of breathing, usually slow breathing. Other symptoms of emphysema include cough and wheezing, and weight loss is often seen. And if emphysema becomes severe and is left untreated, respiratory failure and heart failure can result. So let's look at the diagnosis. Often the individuals can have a sign of a barrel chest, which is basically a protruding chest, as well as you can see muscle wasting. Chest x-rays is often used to diagnose emphysemas, but if that does not reveal anything substantial, a CT scan may be required and performed. Emphysema is usually diagnosed using a pulmonary function test. And to do this test, you usually use a machine known as a spirometry, this machine here. And this machine, the spirometry, will essentially measure the expiratory airflow limitations. So what it basically will do is that it will measure how fast and how much the air you breathe out.
Pros and cons of emphysema. Stay in clean environments. Stay smoke-free. Eat protein and healthy diet with snacks between meals to improve calorie intake and weight loss counter. Cons. The patient should avoid contact with people with respiratory tract infections. Manage all your life's medicines or inhalators that produce bronchodilation. Increase fatigue, change in the color, amount, and character of sputum, nervousness, irritability, fever. No exercise. Similar disease. Asthma is a chronic disease that affects the bronchi, causing an obstructions to airflow. Bronchitis is a abnormal, irreversible dilation of the bronchi. They can be caused by multiple causes. They are usually sequelae of illness, which occurred previously, for example, tuberculosis. Chronic bronchitis. It is mainly characterized by producing cough and expectoration maintained over time. Cystic fibrosis is an inherited disease that is passed from parents to children. Heart failure from any source can also cause disease like we just saw, although you must be aware that it can also be an end result of almost all respiratory symptoms. We can see a video with the diagnostic doctor.
Over 12 million Americans currently suffer from the lung condition known as chronic obstructive pulmonary disease, but there are treatments that can help ease the symptoms.
Chronic obstructive pulmonary disease, or COPD, refers to a combination of two separate diseases which interfere with breathing: emphysema and chronic bronchitis. While there is no cure for COPD, there are a variety of treatments capable of controlling the disease's symptoms and slowing its debilitating effects. The first step in combating COPD is to stop smoking. Without the interference of cigarettes, prescription medications will be vastly more effective against the disease, and lung deterioration caused by years of smoking inhalation will be reduced. The most commonly prescribed medications for those afflicted with COPD are a group called bronchodilators. Bronchodilators, like Alupent and Proventil, relax the muscles around the bronchial tubes, allowing air to flow unrestricted from the mouth to the lungs. There are three types of prescription bronchodilating drugs: beta-2 agonists, which are available in both short and long-acting forms, anticholinergics, which are short-acting, and theophylline, which is long-acting. Short-acting bronchodilators help relieve COPD sufferers at the onset of an attack, while the long-acting varieties help to prevent and control symptoms from developing. Since there are such a variety of bronchodilators, each with varying effects, your doctor will take your specific symptoms into account when deciding which medication or combination of medications is best for you. Another type of drug used to relieve the symptoms of COPD are corticosteroids, which are sold under brand names like Pulmicort and Beclovent. Corticosteroids are anti-inflammatory drugs that work over an extended period of time to lessen the inflammation in the lungs. These medications are available in a variety of forms. Most can be taken through metered-dose inhalers, dry powder inhalers, or nebulizers, which deliver the medication in a very fine mist. Corticosteroids can also be prescribed in the more traditional pill or syrup form. Oxygen therapy is often used to supplement medication and involves supplying fresh oxygen directly to the patient. This therapy may be prescribed if appropriate levels of oxygen are not reaching the blood. Supplemental oxygen can help patients sleep better, complete daily activities with less difficulty, and even prolong their lives. As a last resort, surgery may be recommended for people with more severe cases of COPD. A common surgical option is lung volume reduction surgery, in which small areas of damaged lung tissue are removed. After the operation, the diaphragm will be able to contract more easily, allowing an improvement in the airflow to the lungs. In the most severe cases, it may be necessary for a patient to undergo a complete lung transplant operation. Remember, not every treatment or medication is right for everyone.
It's important to discuss the pros and cons of every option with your doctor and to follow your physician's instructions exactly.
It was all. Thank you very much. My name is Gisela Bonafon.